Hello, future counselor. Welcome to Addiction Exam Study Foundations. Today we're going to talk about drug categories. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment professional. I'm going to teach you everything I know in order for you to study confidently and pass your addiction exam. Let's get started. After watching this entire video, you'll be able to identify the 5 main drug categories and 2 bonus categories if you watch this video all the way to the end. You'll also be able to look at how each category affects the brain and body. You'll also be able to recognize these concepts and how they show up on your addiction exams. And lastly, you'll use this knowledge to answer practice exam questions. What exactly are the drug categories? They're groups of drugs that affect the brain and body in similar ways. That's how we organize and compare substances during assessments and treatment. They're classified based on how they act on the central nervous system. And the main categories include stimulants, depressants, hallucinogens, opioids, and cannabis. The first category is stimulants. These speed up the body and increase alertness. An example of stimulants include cocaine, methamphetamine, Adderall, and caffeine. When studying for your addiction exam, watch for words like increased energy, euphoria, alertness, elevated heart rate, or crashing after use. Anytime you see those clues together, think stimulant, stimulated, fast, energized, and short-term high, followed by a crash. Let's look at a possible exam question you may get focused on stimulants. A 22-year-old client reports using a substance to stay awake, feel more confident, and complete long work shifts. After stopping use, they experience fatigue, irritability, and strong cravings. Which type of drug is this client most likely using? It will be C, stimulant. So let's break down the question. It describes increased energy, confidence, and alertness, which are classic stimulant effects. The withdrawal symptoms include fatigue, irritability, and craving. Also aligns with stimulants. Stimulants activate the nervous system and are often used to enhance focus or productivity. The reason why the other answers are wrong is because depressants slow down the body. Hallucinogens causes perception distortions, not energy boosts. And opiates usually causes relaxation and pain relief, not alertness. Let's look at drug category 2, depressants. These drugs slow down the nervous system and cause relaxation or drowsiness. They're often used to reduce anxiety or help people sleep, but in high doses can cause seriously slow breathing and decrease heart rate. Some of the most common examples you'll see on addiction exams are alcohol, Xanax, and barbiturates. When studying the depressant category, here are the keywords that usually pop up on exams. Slows down, sedative, relaxation, or other clues can be impaired coordination or some type of slurred speech. Let's look at an exam question that may address depressants. A 34-year-old client reports using a substance to calm down after work and help them sleep. During assessment, they appear drowsy, have slowed speech, and mention mixing the substance with alcohol. Which type of drug is most likely being described? The answer is B, depressant. Let's break this question down. We see keywords like calm down, help sleep, drowsy, and slowed speech. They all point to the depressant category. Also, we know that depressants slow down the nervous system, and it also mentions mixing alcohol with a depressant, which increases the overdose risk. Also, another clue that you may see on your exam. The third drug category is hallucinogens. These are drugs that change the way a person sees, feels, and thinks. They distort perception and can cause things like seeing colors more vividly, hearing sounds that aren't there, or feeling detached from reality. Some examples of hallucinogens include LSD, mushrooms, and ecstasy. When you see questions about hallucinogens, watch for the following keywords. They're easy points if you know what to look for. Distorted perception, altered reality, seeing or hearing things. They are big giveaways when they are talking about hallucinogens. When taking your addiction exam, you may see a similar question as this. A client reports using a substance that made them see colors more vividly, feel time slow down, and hear sounds that weren't really there. The next day, they experience confusion and lingering visual distortions. Which drug category best fits this description? It will be C, hallucinogen. Now let's break this question down. Key phrases we see are see colors more vividly, time slowed, hear sounds that weren't real, and visual distortions. They all describe perceptual changes, not energy or not sedation. So it would be hallucinogen. The next category is opiates. They relieve pain and create euphoria, but are highly addictive. Some examples of opiates include heroin, oxycodone, morphine, and fentanyl. Watch for keywords such as pain relief, euphoria, withdrawal symptoms, tolerance, or slow breathing. Most likely they are pointing towards the drug category of opiates. Let's look at an exam question. A client reports using a drug to manage chronic back pain. They describe feeling calm and happy after use, but recently noticed needing higher doses to get the same effect. When they stop taking it, they experience muscle aches, yawning, sweating, and nausea. Which drug category does this describe? It will be C, opiate. Now let's break this question down. Key clues include pain relief, calm and happy, needing higher doses, and withdrawal symptoms. They're all classic signs that point towards the drug being in the opiate category. The fifth drug category is cannabis. Cannabis is unique because it can act both as a stimulant or a depressant, depending on the person and how much is used. It can alter your mood, perception, and coordination. That's what makes people feel relaxed or giggly. Some examples of cannabis include marijuana, THC, and synthetic cannabis include K2 and spice. Some keywords used on addiction exams when speaking about cannabis include altered mood, relaxation, or slow reaction or slow response time. Let's take a look at a possible exam question you may encounter. A 19-year-old client reports using a substance that helps them relax, laugh more, and enjoy food. During the interview, you notice red eyes, slow speech, and mild difficulty focusing. Which category of drug best fits this description? It will be C, cannabis. We see keywords like relax, laugh more, and enjoy food. Also, we see that his eyes are red and his speech is slowed. The reason why the other answers are wrong because A, stimulants increase energy and alertness. Depressant slows the body but doesn't cause euphoria or munchies. And D, hallucinogens, usually you'll see words about altered perception or not feeling like reality. Two bonus drug categories that you might see on some addiction exams include inhalants and designer drugs. Inhalants are vapors that cause quick short-term effects. Some examples of inhalants include paint, glue, nitrous oxide. Also, designer drugs. They're lab-made, they're synthetic, and these include drugs like bath salts or synthetic opiates. The 5 main drug categories you will see on your addiction exam include stimulants, depressants, hallucinogens, opiates, cannabis, and 2 extra categories that you may see on different exams include inhalants and designer drugs. Let's stay connected. Make sure you hit the subscribe button so you're up to date on all new study presentations so you're confidently prepared to pass your addiction exam.